The facial plastic and reconstructive surgery population is racially and ethnically diverse, yet images used in the scientific literature do not reflect this. Our aim was to determine if patient education materials that are more easily accessible by the public better reflect this diversity. To do so, we analyzed patient education materials from 3 facial plastic and reconstructive surgery professional society websites: the American Academy of Facial Plastic and Reconstructive Surgery, the American Society of Plastic Surgeons, and the American Society of Ophthalmic Facial Plastic and Reconstructive Surgery. We also assessed educational materials from Google Images using the search terms rhinoplasty, facelift, blepharoplasty, microtia repair, and facial trauma reconstruction. Images were classified as patient education materials if they came from healthcare educational sources like academic departments, surgeon websites, or journal articles. Since patient race or ethnicity cannot be inferred solely by images, we use the Fitzpatrick skin scale as a proxy based on previous literature. We classified images by Fitzpatrick skin scale and then divided them into 2 groups: Fitzpatrick 1 through 3, which we called F123, and Fitzpatrick 4 through 6, or F456. We assessed 1,071 images from the patient-facing portions of the 3 facial plastic and reconstructive professional society websites, of which 4.7 displayed F456 skin. Additionally, we classified 200 images from each search term except facial trauma reconstruction, for which only 150 images were classified due to repeats that were excluded. Of the search results, F456 skin was represented in 6.5% of rhinoplasty images, 1% of facelift images, 4% of blepharoplasty images, 16% of microtia repair images, and 22% of facial trauma reconstruction images. Out of a total of 950 images from Google Images, 9.3% depicted F456 skin. The images from each search term had a smaller proportion of F456 images than the literature reported prevalence of non-white individuals undergoing the procedures. Important limitations of this study include the fact that we're making an assumption that diverse skin colors represent diversity in race and ethnicity. Additionally, skin colors from various racial and ethnic groups may span multiple Fitzpatrick types. Further, we are using Fitzpatrick skin scale as a proxy for skin color, but the original scale takes into consideration ability to tan or sunburn, which cannot be assessed with a single image. Given the visual nature of facial plastic and reconstructive surgery, images used in patient education materials are an important source of information for prospective patients. The literature suggests that underrepresenting racial diversity can be perceived as cultural incompetence on part of the provider, which may alienate patients and influence how and where they seek care. Thus, in order to reduce disparities in this area, we believe that investigating the barriers to providing more diverse patient education materials is needed. We also recommend that efforts be made to provide education materials that better reflect the diversity of the facial plastic and reconstructive surgery patient population.